And then getting into your journey, I'm guessing before you know anything about health tech and that intersection of public health, you started off, or you part of your journey started off as a bachelor's of science in health science at Aurora University. Walk us
Mhm.
through that thought process and that journey to get there.
Yeah, it's so funny to me because I think about how I never really intended on going to Aurora University. In fact, I started at the sister school of George Williams College pursuing a psychology degree. Back to a little bit earlier, we were talking about I've always been interested in behavior design and the way we think and why we do the things we do. So I thought that, you know, to make a change in healthcare, I would pursue medical school. So I would have all of this understanding about why people behave the way they do and then go to medical school. But things didn't necessarily work out that way. What stood out to me initially was GWC, Georgia Williams College, their mission, which is discover what matters and build your life around it. And it was reflected in different coursework around social innovation, entrepreneurship, and inclusivity, which has some of the most profound influence on how I see the world today. And my big I have a dream idea has always been to build and design my own community health center that blends healthcare delivery, technology, and behavioral design. And I thought the way to do that was I needed to become a doctor. Number one, to secure the resources to do that, but to also fulfill the vision and have the credibility to build a community health center. But once I transferred to Aurora University, I switched my major to biology, and I did it for 2 years until I realized I had like 3 or 4 different plant sizes that were required, and I said, I'm not really interested so much in learning about the anatomy of plants. And so I went to my counselor. I said, "Is there any way I can preserve the existing credits I have while also still studying the things that interest me?" And there was a pathway to do that with health sciences. All this time I thought I was building a compelling case for medical school. I had been surrounded by doctors since birth. Um, I've always been a science geek, and at the same time, while at Aurora University, I was working as a medical scribe in the emergency department, while also working at the campus coffee shop and in the catering department. And then I also went to Spain, where I shadowed four different departments in hospitals across Spain. And so I was like, I have everything I need to go to medical school. I got leadership experience, I got work experience, I have all the credits I need. That was until I got to physics class. And I could not pass this class for the life of me. So I got halfway through the semester. I decided to drop it. And during that summer, I started working at the National Student Leadership Conference, where I really first learned about public health through Northwestern giving a presentation about the Institute for Global Health. So that was 2016, and during that time, once I graduated, I decided, I'm going to take a gap year. Like, I got 2 years till I graduate. Let's take a gap year. Let's explore that. And that's when I ultimately went to Kenya, and I went there for 4 weeks and had the opportunity to volunteer abroad. And being able to do that with people from all around the world and understand the difference in public health systems, now that I've seen America's healthcare system, Spain's healthcare system, and now I'm seeing Africa's. Um, that cements my love for public health right there.
Wow. That definitely is quite the journey, and definitely wish you all the best in actualizing the plan for like your healthcare center that is a hub for all things necessary for health and improvement of health and behavior change. And I'd love to see how you're able to like just like mold your journey from that early start. And I think it's so important that we do highlight uh that there's always the evolution of, yeah, okay, I want to do medicine, I'm glad that you also mentioned that, yeah, okay, you want to do medicine, you set yourself up to do all the things to become a doctor or to apply and go to medical school, and still you were able to find a path to do work that you said maybe fulfilled more of what you were doing and learning more about public health. And I think about it like, if you didn't take those experiences, if you didn't go to Africa, would you have known about public health, and would you have been exposed, or would it have been something that came later? And it's so important just to like jump on experiences, because you never know like how that really is going to shape the path that you take.